I'm a woman in her 40s with little kids and a extremely full-time job. And so I actually don't think the word balance exists in my vocabulary. I think I read somewhere replacing it with juggle might be a better descriptor. My name is Jannine Versi, and my title is CEO and co-founder of Elektra Health. I grew up in London, and then my family moved to the US when I was around 10 years old. Both of my parents were doctors. They are doctors, and that was really what brought them to America. And I think I grew up always sort of being interested in healthcare. I'm one of those women that had a really hard time, a long journey to get pregnant. And by the time, you are pregnant or postpartum, that can intersect with perimenopause really easily. And it's hard to discern what is what. I had a very complex pregnancy. I had a kid in the NICU. And so I feel like I've seen a lot of the women's health solutions that are out there really focused on family building and maternal health. And then I do think there has been this gap, sort of like, okay, what happens after? And more recently, there's more talk about perimenopause. But when we started Elektra years ago, people were like, menopause? Like, that makes me think of my grandmother. Well, many women start perimenopause in their late 30s or early 40s. So Elektra is a women's health clinic that is focused on providing virtual care and support to all patients navigating perimenopause into their postmenopause years. The opportunity is, for me, providing evidence-based, high-quality care from specialists who have been trained in medicine, but then receive additional training in menopause and midlife women's health. And it's really a multidisciplinary specialty approach that includes a lot of education and support specific to this time of life. We focused on that accessibility and with insurance, and that includes individuals who have Medicare and Medicaid. We do not sell any products, supplements, medications, and we want our patients to trust that the services we deliver are focused on what is best for them. And access to clinical care is one thing, but we've created this model for coaching and support and community because that has been so missing in this time of life. I think that moral compass comes from my family and, having parents who are scientists who are always focused on doing research, more research, better research, research in women's health, which has been, deeply neglected. As a patient myself, want to know what is being recommended to me and why. I'd like to have a dialogue with my provider, and that requires trust. When we first started in this space, nobody was talking about menopause, and it reminded me a lot of what's happened in the mental health space. It's very stigmatized. It's very taboo. That is for women themselves. I think sometimes the biggest obstacle is that women don't usually put themselves first. If they have families, they tend to prioritize their families. But there are lots, being a female founder of color, navigating challenging fundraising environments. We've seen COVID, we've seen banks collapse. And every day, week, month brings a new set of challenges, but and also what keeps it really exciting. The Catalyst team is really exceptional. I think the reason it's exceptional is because it recognizes some of the challenges of being an early stage startup. So you are building the plane as you're flying it. And I think Catalyst does an excellent job of understanding where are the opportunities for synergy together. It's not easy to do, especially on your own. And so the Catalyst team, I think, really bridges that gap, bringing the two sides across the aisle in a way I haven't seen done before. My dream is that every single woman approaching perimenopause and that menopause transition has the opportunity to have high quality care that is just part of her regular healthcare journey, just like we expect our kids going to the pediatrician are going to get information and counseling and support around puberty and adolescence. It is the same thing for women approaching menopause. There are very real health risks to be aware of. There are very real symptoms to contend with, and we all deserve the opportunity to be taken care of and to live well, and to age in good health.